Cheka. Cheka. Good day, codemates. Welcome to our channel. In this episode, we will be discussing all about sepsis coding. I am the medical coding guy. Before we start this episode, if you haven't subscribed to my channel yet, feel free to do so and hit that notification bell and comment down below for the things that you want me to discuss in the future. Okay? So let's start. Our episode for today is your sepsis coding. So things you need to have are the following. Alright. You need to have your, of course, your ICD-10-CM manual. You can use your 2021 version if you will be using it for your exam, of course. So at least the updated codes are there. But for review purposes, you can use any versions of ICT book as long there are guidelines listed there, so you can easily check the guidelines here. And also any PDF version from the CMS website will also do. Okay, but for your exam, you need the actual books. Okay, all right. So objectives, of course, we will be discussing all about sepsis. Right? What are the common terms? We will also discuss the coding guidelines for sepsis and some practice questions and scenarios. So let's start. What is sepsis? So sepsis is basically a systemic infection that occurs in the bloodstream which affects a certain tissue or a certain organ. Okay, but we will be discussing the different terms related to your sepsis later on. Let's discuss first the minor terms for sepsis. You have first your bacteremia. So from the term bacter, pertains to your bacteria. Emia pertains to what? Blood. So bacteria in the blood. So basically it's presence of bacteria in the blood without an associated inflammatory response. Okay? So for example, the doctor or the MD has noted the presence of E. coli in the blood. So that's going to be considered as R78.81. Okay? Alright. The next term is your SIRS or Systemic Inflammatory Response Syndrome. So again, in most medical records, you will see this as SIRS. But you have to check your subcategory R65.1 for the difference between SIRS and severe sepsis. So let's check to your category R65. Here you will see your subcategory R65.1. Please highlight the term non-infectious origin. Okay? Alright. So from this R65.1, if you will compare it to R65.2, R65.2 is because of infectious origin. So that's the main difference between the two. This one, it's systemic response by the body due to non-infectious origin. For example, the patient has any trauma that creates a systemic response in the body. So that's going to be coded under your R65.1. But if the infection is the reason or the causal, what do you call this? Is the cause rather of your sepsis, then you will go ahead and code it from your subcategory R65.2. Okay? So you have R65.10 and R65.11. The main difference between the two is it associated with does it have an acute organ dysfunction or not? So that's the only thing that you need to double check. Okay, so that's going to be it. Next, I will show you this diagram. Okay, so most of the coders use, especially if you're coding a lot of sepsis in your facility or department, so you can check this diagram. So as you can see, SIRS is not associated with any infection, but your sepsis, as you can see, is what you call this, is combined with your infection and bacteremia. Okay, So that's the main difference between SIRS and your sepsis. So also, your SIRS is maybe due to trauma, maybe due to burns, or pancreatitis, for example. All right. So if the patient has any sort of systemic response in the body, that may be because of this type of diseases or trauma. All right. So as you can see from the sepsis, it's due to these microorganisms, for example, fungi, parasites, virus, bacteria, or other stuffs. Okay. So that's how you will use this diagram. So if you want to take a picture of this, please free to do so. Or you can take screenshots as well. Okay. So let's now talk about septicemia. Okay. Septicemia, if you will be checking your ICD-10 if you will be checking your alphabetic index, it will route you to A41.9. Septicemia not otherwise specified is under your sepsis unspecified organism. So please double check that. If it's only mentioned the term septicemia, code your A41.9. Okay? So that's going to be it. Septicemia versus sepsis. But again, if your sepsis is undefined or unspecified, the causal organism is not mentioned, you will be coding your A41.9 as well. Although they're not the same when it comes to the term itself. If ever that you will be using your ICD-10-CM manual, please refer to your alphabetic index and your tabular index. Okay, so double check this. Check the term unspecified and not otherwise specified. Alright, so next is your severe sepsis here, which is located from this guideline section. Again, if ever that you want to check the specific guidelines, locate this under your book. Okay, it's all here. So let's now talk about severe sepsis. Severe sepsis is from your code set R65.2. Okay, if you will check your tabular index, it's clearly mentioned here that it's between your severe sepsis without septic shock and severe sepsis with septic shock. So double check this too as well. Okay, according to your ICD-10-CM coding guidelines, your severe sepsis requires 2 codes. Okay, all right, let's check the screen here. Code for the underlying systemic infection comes first, followed by your R65.2 subcategory. So that's going to be it. Check if there's any septic shock or without septic shock, and that's it. If the causal organism is unknown, assign A41.9 as your what? As your primary diagnosis. Okay, so that's going to be it. If there's any associated acute organ dysfunction, let's say kidney failure, okay, liver failure, you will be coding those as additional. Okay, but always remember, you might want to query your provider, query the provider, or ask the provider for certain cases that you're getting confused with. For example, the associated organ dysfunction, is it due to severe sepsis or not? Please double check it with your provider. Okay, all right, and then let's now talk about septic shock. So septic shock requires you to see some terms like the term shock from your medical record or the term circulatory failure. Okay, so those are the terms that you might want to check in the medical record before you code your septic shock. So septic shock is located where? R65.21. So basically, you can only code this septic shock if you have it documented by the provider. Okay, so that's going to be the same guideline: systemic infection first, followed by R65.21. Okay, all right. We also have guidelines for post-procedural infection, which is located right here. Okay, so it's under number 5, guidelines of your sepsis. So please double check the code sets from this portion. Again, there are lots of confusions around this post-procedural infection. If the sepsis happened, all right, after procedure was done for the patient, you have to check it from the medical record, okay? And then you have to check the code sets from your T81.4 from 0.40 to T81.43, okay? So if you will check those codes right now, I don't want to dig deep for this one because we will be taking over an hour if I will show you all the things about your sepsis because it's a complex procedure coding, okay? I mean diagnosis coding. T81.40 unspecified, so please check what's the surgical site, what's the type of surgical site that is present, okay, after the procedure is done, okay? So that's going to be it. Yeah, that's it. So after that, code from 086 from 086.00 to 086.03 if it's pregnant, of course, after any um, obstetric surgical wound happen or any delivery happen. So you might want to check this one as well. Alright, assign an additional code for T81.44 if there is a sepsis mentioned, okay, or this if it's a pregnant patient. And if the patient has severe sepsis, assign code from category R65.2. Again, you have to check the following terms from the record before you choose from your sepsis: severe sepsis and septic shock, okay? So this is what I call the triple S's, okay? Because again, without the terms that you need to check, just like what I mentioned earlier, you should only settle with the lower tier, okay, which is your sepsis, especially if the causal organism is unknown, okay? All right, so let's now I mean there's a lot more guidelines here about after infusion, transfusion, any injection or immunization, so you have to check this code sets as well, okay? So that's going to be it. Again, if ever that you have a question with your sepsis coding, especially the post-procedural sepsis coding, you might want to check this portion, okay? Number 5 guidelines of your sepsis. Okay, so let's so we're done. So we're done with all of your sepsis coding. We will apply what we have learned so far. All right. So again, just a brief reminder: you have to check the terms bacteremia, septicemia, sepsis, severe sepsis, and then your septic shock. And don't forget as well the term post-procedural infection. So those are the key terms, okay? And then please remember the triple S in coding most of your cases for sepsis. So let's now apply it into practice. So what is the correct sequencing for severe sepsis with septic shock? All right. Is it R65.21 and then A41.9 as secondary? True or false? Of course, if ever that you forgot what I told you earlier, all you need to do is to go. Septic shock was mentioned here, severe sepsis was mentioned here. You need to go to your R65.21 because septic shock was mentioned. However, are you going to code it as your initial diagnosis? That's the main thing, okay? So as you can see here in the code first section, code first the underlying infection. And if the causal organism is unknown, it was not mentioned here what type of organism is present, then code A41.9 as your first diagnosis. So the answer for this question is false. That's how you will do it. If you will be taking the exam, all you need to do is to check your code first, and if ever that you're practicing already this coding, please be efficient enough, okay, to check your coding guidelines. You can ask your colleagues about this, okay, or your coding manager, okay. Let's have this question. All right, this is more inclined in the exam question, but it can happen as well in your facility. All right, if in case you have the same scenario. Bambi was admitted with severe sepsis due to MRSA. So that's methicillin resistant Staphylococcus aureus. So again, you have to be familiarized with your terms, especially abbreviations and acronyms like this. with septic shock. So again, we will be using your R65.21 here since septic shock was mentioned. Again, there are some exclusions for that, especially with your post-procedural sepsis. But again, refer to the guidelines I showed you earlier. Septic shock and acute respiratory failure with hypoxia. So what is the first code that we will enter? So divide this into this sequence. R65.21 is coded here as the primary diagnosis. We will eliminate this because the causal organism is mentioned, MRSA. We will not be coding this as your primary diagnosis. So you have it A41.01, A49.01 rather. Let's check that one. Your A49.01 is your MSSA. So basically that's your methicillin susceptible staph aureus. If you will go to the next code, A49.02, that's your MRSA, methicillin resistant. So again, methicillin is a type of antibacterial drug, okay? But in some cases, the bacteria that attacks the body, specifically your staph aureus, is resistant to methicillin. So it's harder to treat, okay? So A49.02 is listed here. It's not going to be your answer, okay? But if you will check your A141.02, as mentioned here in letter B, sepsis due to MRSA. Oh, no. MSSA, yes. This is MRSA, sorry. Methicillin resistant. So this is your MRSA, MRSA. Can we code A41.02? Yes, we can. So we put a little check mark here to indicate that, oh, this is the one, this might be the answer for this question. And check your J96.01. So we have a battle between B and D only, okay? J96.01. So this is your respiratory failure. Yes, acute respiratory failure with hypoxia. The only thing here is you can also see your your J96.01 in letter B. You can also see it in letter delta. So the only issue here is the sequencing. But according to your R65.21, you have to code the causal organism A41 if it's available. Okay? So let's go again to R65.21 and check. Alright. So again, that's going to be it. Use additional code only for the type of acute organ dysfunction. Since it's mentioned here J96.0, you have to code it after your R65.21. So in that case, letter B is the final answer. Causal organism first, MRSA, R65.21, followed by your acute organ dysfunction. That's it. That's an easy question for you. Next, Arnold S. was admitted with septic shock and acute renal failure caused by UTI due to E. coli. Okay, so this charge summary states sepsis due to E. coli. So you have to check this code sets here, divide it into this portions. Let's check first your term. You have the term septic shock here. Since septic shock is mentioned, R65.21, R65.21, there's nothing here. Letter C. Letter delta, you have R65.21. And most probably, you have to code it as secondary. Eliminate letter boy. So we're probably looking at letter A and letter delta here. Okay? But let's check first your N39.0. Your N39.0 is your renal failure, I guess. Oh no, it's the UTI rather. Sorry. Your urinary tract infection or UTI is coded first in letter A. So we all know that this is UTI. UTI, acute renal failure. Let's check your letter C, A41.9. A41.9 is what? sepsis due to unknown what? Unknown origin or unspecified or organism. Okay? But if you will check A41.51, that's sepsis due to E. coli. So we can use letter delta much better than letter C. Eliminate letter C. So you will now check between A and D. If you will check this A45.51, let's check what's that code. Oh, A45.51, really? There's no code for that, okay? Maybe this question pertains to, one second. I'll just change it a little bit. One second. Sorry for the typo. This might be a typo. Yeah, that's much better. Okay. Going back, we've eliminated letter B because R65.21 is coded first, and yet you have the causal organism. C as well is not coded because your E. coli is mentioned. So we will now be choosing between these two. So R65.21 is mentioned here at the last portion, although your N17.9 is your associated what? Organ failure. So acute kidney failure will be your last code to be coded because it's mentioned under R65.20 or R65.2 guidelines that you have to put it after the acute organ failure should be coded right after that. Letter delta should be your answer here. Okay? Are we clear? Yes. So let's now go to your last question. Okay? Mr. Kronkowski is admitted with sepsis with septic shock. So another septic shock is mentioned. With acute hepatic failure. So this time it's the liver organ that is failed. Okay? It has failed due to Bacteroides fragilis. Patient is now in a state of coma. Right. R65.20, this is without septic shock. Eliminate this. R65.20 as well here. Eliminate. So we now have your letter B and letter C. So what's the difference between this? The code K72.01 and also your A41.89. Let's go to K72.01 first. Your K72.01 is acute and subacute hepatic failure with coma. Is there anything mentioned about coma? Yes. Is it acute hepatic failure? Yes. So we can simply code this. However, the guideline states that your organ failure should go after your septic shock. We will choose letter C instead. And your A41.89 is your causal organism. It's the Bacteroides fragilis. Okay? But it will fall under the category other organisms. Okay? So letter C is the final answer in this question. So that's it for today. And again, if you have any questions, suggestions, clarifications with this topic that we have discussed, feel free to do so. And from this point moving forward, if there's any specific exam question that you will be facing with sepsis, you know where to locate it. Just go to this chapter specific guidelines under your sepsis. You will be seeing here. Remember, your exam is an open book. Okay, and if it's about the real life coding scenario, just try to follow up with the things that I have mentioned. The coding sequence is an important thing as well. Okay, don't forget to query your provider if it's really needed. All right, so I think that's it for this day. That was a short one, and I hope to see you soon. We'll be discussing next time your neoplasm. I mean, if I will be having the time for that, I will make sure to update you as well. Okay? For now, that's it. So long. Goodbye. See you next time.